everybody. Today we are going to talk about PCOS. PCOS is Polycystic Ovarian Syndrome, and it is something that many women are diagnosed with, and maybe you yourself have it or you know someone who has been diagnosed with PCOS. I was diagnosed with PCOS sometime around late high school, and all I was told was that I had cysts on my ovaries and that I would probably have trouble getting pregnant at some point in my life. And I was told that in order to treat this, we would use birth control. So I was prescribed hormonal birth control because I had symptoms of, I had excess hair on my face. I had horrible periods in terms of cramping, heavy periods, and then also headaches with my periods. And so I was told the pill is going to magically fix all of this. So that is what they put me on, and that is the protocol that I was on. And probably until my late teens, up until about 2 years ago when I learned all the things about PCOS from functional medicine doctors. And so I want to dive into PCOS with you today, talk about what it is, how to properly get diagnosed, and whether or not it's a true life diagnosis. PCOS, or Polycystic Ovarian Syndrome, is a group of symptoms related to anovulation, which is a lack of ovulation, and higher androgen levels, which are those male sex hormones. PCOS is typically known for irregular periods, weight gain, facial or body hair, and then also fertility issues. But it can also lead to heart problems, which makes this a much bigger issue than just period problems. I was diagnosed with PCOS just by ultrasound. And so we went in and we did an ultrasound. They found that I had cysts on my ovaries. But in fact, PCOS does not actually mean cysts on your ovaries, despite the name. So what they see on an ultrasound are actually ovarian follicles, and they're very normal, and everybody has them. So what happens is, any point throughout the cycle, you're gonna have different amounts of follicles on your ovaries. And so if you go in on a day and get an ultrasound where you have a lot of those follicles on your ovaries, those are going to appear as cysts, when in fact they are just ovarian follicles. Those are typical. What they do is they grow, they burst, they reabsorb. A typical sequence looks like this. In an adult woman, you have up to 12 follicles that develop throughout your cycle, leading up to ovulation. So there's going to be one follicle that kind of overpowers all the other ones, and that becomes the one that then progresses into ovulation. For someone with PCOS, that one dominant follicle never actually overpowers the other one. So you have multiple little follicles, which is why it is called PCOS, Polycystic Ovarian Syndrome. So when you look at it on an ultrasound, it's going to look like you have multiple cysts. So if you go in any moment of time and you haven't reached that point where that one dominant follicle formed, of course it's going to look like there are a bunch of little follicles. So that's why it's unfair to say that you have PCOS based on one moment of time with one ultrasound, because although you might not have ovulated that particular month, which resulted in having multiple follicles, it doesn't mean that you won't ovulate the next month. So then if you did go in a month later and you ovulated, you would have that one dominant follicle and your ovaries would look completely different. So that's why it's just not very accurate to only diagnose PCOS with just an ultrasound. So since you can't diagnose PCOS with just an ultrasound, you're going to want to look at other factors. And there's 3 things we're going to talk about here. You're going to want to look at ovarian dysfunction. So are you ovulating, and do you have irregular periods? You also want to look at your androgen levels. So if your androgen levels are high, that's also an indication of PCOS. And then you also want to rule out all other reasons for high androgen levels. So you might be asking yourself, how do I know if I have high androgens? Well, you could just kind of look at yourself and see if you have any of the characteristics of high androgens, but to be more accurate, you want to get tested. Some of the physical characteristics of high androgens are excessive hair growth on your body and like around your face. You also might have acne around your face, and then also having hair loss or hair thinning. To test your androgen levels, you're gonna wanna look at several things that are nicely outlined in the Dutch test. So the Dutch test is another test that I recommend to all my clients, and I myself do a couple times a year. And I love all the information that the Dutch test gives you because it gives you a nice understanding of whether or not you have high androgens and whether or not you prefer to be androgenic or not. So we've talked about what PCOS is, how to get tested for it, and why it occurs. Now, I want to talk about whether or not PCOS is a life sentence. When I was first diagnosed, it sounded like it was something I was always going to live with. And the reality is you can absolutely reverse your PCOS. I did. So in order to reverse your PCOS, you have to really understand what your driver of PCOS is. And we're gonna talk about that in another video. But you really need to understand where your PCOS is coming from and work at it from that perspective to reverse your PCOS, because it is not a life diagnosis and it is absolutely something that you can reverse and no longer live with. I hope that was helpful, and stay tuned for the next video on what the drivers of PCOS are and how to find out what your driver is.